My name is Dr. Thomas Satterwhite, and I will be speaking about top surgery for trans men. Top surgery for trans men involves masculinizing the chest. The ultimate goal is to reconstruct the chest so it matches the individual's identity. Chest masculinization or mastectomies or top surgery are going to be appropriate for trans male patients and also for gender nonconforming as well as non-binary patients. There certainly are a whole multitude of operations which I can tailor from a case-by-case basis, but from a general discussion standpoint, there are three primary operations. The first one is referred to as a double incision. This is what I perform for probably 90% of my patients. So there's a variation of a double incision that's referred to as a buttonhole. So this is a second type of operation that I perform for patients. And once again, this is in a smaller subset of patients. But for patients who come in and they want to preserve nipple sensation, then the buttonhole technique is a good way to go. The third type of operation that I perform is referred to as a keyhole. And this is going to be an operation that's reserved for someone who's young, who's got very good quality skin, and has very, very minimal breast tissue development. The operation itself, typically about 2 hours. It's an outpatient procedure, so after the operation you can leave. You'll have a pretty snug binder, and that needs to stay on for about 1 week after the operation. It's going to be pretty tight, but it's really important to have that binder in place to make sure that you don't have any bleeding or swelling, and that binder does stay on for about 1 week after the operation. For the first month after the operation, no heavy lifting, nothing heavier than 20 pounds is really important, and you cannot raise your hands any higher than the top of your head. Most patients are ready to get back into school or work in about 2 weeks post-op. The overall healing process may take up until about a year. Complications include scarring. So the best thing to do to minimize scarring is, well, number one, have a good surgeon. So I will do everything that I can to make sure that you have a nice closure, to make sure that everything looks good at the end of the operation. Puberty in and of itself is a difficult process, but to have to go through puberty in the wrong body is horrendous. So it's a truly rewarding operation that benefits so many patients.